The Skinstructors tip of the week. As estheticians, we often focus on the face, but remember that the scalp is simply an extension of the skin on the rest of the body, and it deserves just as much attention. A healthy scalp is the foundation for healthy hair. Just like you wouldn't neglect facial cleansing and moisturizing, don't forget to incorporate targeted scalp care into your client's routine. Maintaining a balanced scalp microbiome and ensuring adequate blood circulation are key. Consider recommending or retailing gentle scalp exfoliants, such as a scrub or a clarifying scalp massager, that they can use in the shower to gently exfoliate their scalp. These small additions can make a significant difference in overall scalp health and in turn provide stronger, healthier hair growth for your clients.
Hi everyone, welcome back to the Skinstructors. I'm your host Jolie.
And I'm Morgan. We're so excited to dive deep into the world of scalp health with you all. Last episode we touched on the foundations of scalp care, and today we're taking a deeper dive into a topic that affects so many of our clients: hair loss. It's a conversation we have with clients all the time, and it can be really distressing for them. As estheticians, understanding the nuances of hair loss allows us to offer more comprehensive support and guide them towards effective solutions.
Absolutely. And if you haven't listened to last week's episode, definitely go do that because this is kind of recapping on some of that. So last week we did touch on hair follicles, but it does bear repeating. Hair follicles are living, growing microorganisms. They will keep living, growing, and thriving as long as you do the right things to care for them. We have over 1 million hair follicles on our heads.
And what's fascinating is that your hair follicle is one of a few structures in your body that can stop functioning and actually begin functioning again. This process helps with hair growth on your body. It gives us so much hope for reversing some of the signs of hair loss.
And beyond just hair growth, our hair follicles are incredibly multifaceted. They also help repair your skin after a wound or an injury. They form new blood vessels and form new nervous system neuron cells. They're really miniature powerhouses.
And to keep those powerhouses going, capillaries are essential for blood circulation. They provide blood flow to the papilla and keep the hair follicle growing. No blood flow equals no hair follicle. This really highlights why proper scalp circulation, which we discussed last time, is so important.
We also have natural growth factors that live around the hair bulb. The challenge is when we age and leave our scalp unhealthy, we naturally debilitate the ability to create growth factors. This is why proactive scalp care is so vital.
Okay, let's take it back to aesthetics school real quick and do a recap of the hair growth cycle. This is going to be foundational to understanding hair loss. So these phases that we're going to talk about, these time frames are specific to the hair on your scalp. So your anagen phase, this is the first phase of hair growth, and it can take 2 to 7 years. So growth begins at the root of the hair follicle, which gives the hair blood supply and the nutrients it needs to grow. Hair grows about 1 centimeter per month. This is where we want our hair to be.
Then we have the catagen phase. So this second phase of hair growth occurs when the hair transitions from a growing phase to a resting phase, which takes about 2 weeks. During this phase, the hair detaches from the blood supply and the follicle becomes dormant.
Followed by telogen, which is the resting phase. That's when your hair stops growing and prepares to shed, and this phase can last about 4 months. During this phase, a new hair strand begins to grow over the old hair strand in the follicle.
And finally, exogen, the shedding phase. When individual hair strands are released from the follicles, they fall out.
So when we talk about hair loss, it's about disruptions in this natural cycle. What's interesting is that hair growth will be on a 3 to 6 month cycle.
And a bit of a reality check. 90% of hair is in the anagen phase. It's normal to lose up to 100 hairs per day, so don't panic if you see a few strands in your brush. However, once you've noticed excessive shedding, you've potentially lost 30 to 50% of your hair. That's when it's time to start taking action.
The statistics are pretty clear. 85% of men and 50% of women experience hair loss. hair thinning, or poor scalp health. It's a widespread concern.
Yeah, one of the biggest players in hair loss, especially for women, are hormonal factors. Hormones are like chemical messengers. They help maintain balance in our bodies. And when that balance is off, it can manifest in several ways, including hair changes.
Think about it. Hormones regulate growth and development, reproduction, metabolism and energy balance, contraction of smooth and cardiac muscle, and some activities of the immune system. It's a huge system. And when it comes to hair, hormones have a significant impact on hair growth, cycle, and density, and can affect hair shape, texture, and loss.
Let's break down some specific hormone influences. Pregnancy, for instance, high levels of estrogen, proestrogen, and prolactin can prolong the resting phase of the hair cycle, which can lead to less hair loss during pregnancy. However, a drop in hormones after delivery can cause increased hair loss. Many new moms experience this postpartum shedding.
Then there's puberty. So hormonal changes can affect the function of genes that influence hair shape. For example, someone with wavy hair may develop curly hair. It's a time of big shifts for the body.
Androgens are also a big one. Androgens like testosterone and dihydrotestosterone, or DHT, are key factors in terminal hair growth. They can convert small, straight, vellus hairs into darker, larger terminal hairs. However, DHT can also attack the hair follicle, causing it to shrink and become smaller. This can make terminal hairs shorter and thinner, and they may turn into vellus hairs or baby hairs. This is a significant factor in male and female pattern baldness.
And speaking of hormones, let's not forget about the thyroid. So, thyroid hormones are essential for producing keratin, and low levels can cause dry and brittle hair. Hypothyroidism can cause a decrease in anagen frequency, while hyperthyroidism can cause thin hairs. This is why a client's overall health and medical history are so important to consider.
And for our female clients, estrogen plays a huge role. Estrogen encourages the development and thickness of hair. During menopause, estrogen levels drop dramatically, which can cause hair thinning, brittleness, and changes in texture. Lower estrogen levels can also mean less sebum production, which can lead to dry, flaky skin and scalp, and drier, duller, more brittle hair. This is something many women in their 40s and 50s will relate to.
Finally, insulin. Insulin promotes hair growth by stimulating the proliferation of cells in the hair follicles. Diabetes can cause hair loss, but good blood sugar control may help slow or stop it. Another example of how systemic health impacts hair.
And circling back to DHT, we want to emphasize the impact of DHT sensitivity, which is a genetic trait that makes a person's cells more responsive to DHT. This hormone can really wreak havoc on hair follicles.
Right. When DHT binds to receptors in hair follicles, it shrinks them and shortens their growth cycle. This can make hair appear thinner and more brittle and cause it to fall out more quickly. The classic signs are often a receding hairline, thinning hair, a Norwood balding pattern, and brittle hair.
And it's not just about hair, Morgan. DHT's potential to cause harm goes beyond your hair. Research has linked especially abnormal high levels of it to enlarged prostate, prostate cancer, and polycystic ovarian syndrome. So addressing DHT sensitivity can have broader health benefits.
So beyond hormonal imbalances, there are various hair loss conditions that our clients might present with. The umbrella term for hair loss is alopecia. There's androgenetic alopecia, which we just discussed with DHT, often referred to as male and female pattern baldness. But there's also alopecia areata, which is an autoimmune condition where the body's immune system mistakenly attacks hair follicles, leading to patchy hair loss.
And then you have conditions like telogen effluvium, which is temporary hair loss due to stress, illness, or trauma, causing a larger percentage of hairs to enter the telogen phase prematurely. There's also traction alopecia, which is prolonged tension on the hair follicles from tight hairstyles. This is why client consultation is so important, because understanding their lifestyle can help give us clues.
Absolutely. And now let's talk about some solutions. So, one area that has been a significant rise in popularity is nutraceuticals. These are supplements derived from food sources that offer additional health benefits. And a prime example that many of our clients ask about is Nutrafol.
Nutrafol and other similar nutraceuticals aim to address the root causes of hair thinning rather than just treating symptoms. Nutrafol contains a blend of vitamins, minerals, and plant-based ingredients that target things like stress, inflammation, hormonal imbalances that contribute to hair loss. Things like marine collagen, ashwagandha, saw palmetto, and kikurum are often found in these formulations, working to support the hair growth cycle from within.
It's really about nourishing the body to support healthy hair growth. We always recommend that clients consult with their doctor before starting any new supplement regimen, especially if they have any underlying health conditions.
And in terms of in-office treatments, we briefly touched on Hydrofacial Keravive last time. It is a fantastic treatment that works to cleanse, exfoliate, hydrate, and nourish the scalp. It uses a vortex technology to remove impurities from the hair follicles and infuse a peptide complex solution.
Absolutely. Keravive is excellent for creating a healthy scalp environment, which is the foundation for hair growth. But for more significant hair loss concerns, we love Scalp PRP. It's really exciting and it's an effective treatment.
Yeah, PRP stands for platelet-rich plasma. It involves drawing a small amount of client's blood, processing it to concentrate the platelets, then injecting this platelet-rich plasma into the scalp. These platelets are packed with growth factors that stimulate hair follicles and promote new hair growth.
It's using the body's own healing mechanism to encourage hair regeneration. Like Keravive, PRP treatments typically require a series of sessions for optimal results, often starting with monthly treatments for a few months, followed by maintenance sessions. Remember, hair growth will be on a 3 to 6 month cycle, so one treatment will not be enough. This is a key point for managing client expectations.
Yeah. A simple practice you can incorporate into your treatments is scalp massage. Regular scalp massages can significantly boost blood flow to the scalp, which in turn delivers more oxygen and nutrients to those hair follicles. This improved circulation can possibly stimulate hair growth and even make existing hair stronger. Plus, they feel amazing and can reduce stress, which we know is a factor in hair loss.
Yes, I love when a facial includes a scalp massage. I know you do too, Jolie.
Yeah, I sure do. I used to try and incorporate them into almost all my facials when I was still seeing clients regularly.
All right, so for our Skinstructors homework this week, we want you to do a few things. First, revisit the hair growth cycle, and make sure you feel confident explaining each phase to a client. Then observe, pay closer attention to your client's hair and scalp during your treatments. Are there any subtle signs for thinning or poor scalp health that you might have missed before? Research. Look into a few different nutraceutical brands specifically for hair health. Understand their key ingredients and how they support hair growth. And lastly, practice. Imagine a conversation with the client experiencing early signs of hair loss. How would you introduce the concept of hormonal influences or the benefits of PRP?
Excellent homework, Morgan. The more we understand, the better we can serve our clients. You can tag us on Instagram using hashtag the Skinstructors homework or send us a message at SD Training.
That's all for this episode of the Skinstructors. Don't forget to subscribe, rate, and review on whatever platform you listen to our podcast on, as it always helps. Until then, don't hesitate to educate.